Hi everyone, welcome to our webinar. Today we're going to be talking about leaky gut. I'm Dr. Kelly Clough, I'm a naturopathic doctor.
I'm Marian Mitchell and I'm a health coach.
So in my practice, gut healing is a big part of it. Our digestive tract is really the foundation of our health. And so whether someone has leaky gut or some other gut condition, addressing the digestive issues is really important to set the foundation for health. And really, no matter who I'm working on, I'm looking at their gut and looking at their dietary health.
And I'm an integrative nutrition health coach. I specialize in working with those individuals with food allergies and autoimmune disease. And the foundation, again, is the gut. And if we can repair the gut, we can get you feeling better a whole lot faster, get those symptoms in remission, and you can go on living your life.
Great. And so leaky gut, it really is a big topic in the wellness community right now. I'm sure you've all probably heard of it. If not, if you do a Google search, you'll see a lot of it in the news. And so where is leaky gut in the news today? You're going to see it in blog posts and articles, on TV. It's really all over the place. And so people want to know, what is leaky gut? And is it something I have to be concerned about? And what can be done about that? Have you heard that, Marian?
Oh, yeah. I get emails and questions all the time asking me, what is it? What causes it? How do I get rid of it? Should I be concerned?
Right.
And the answer is most people have it. Unfortunately, it's we're going to go through what causes that coming up, but it's a lot of diet and lifestyle, and it is reversible, and you can heal.
Yeah, and it's still one of those things where even WebMD, they wrote an article where they definitely admit that it's a thing, but we don't know a lot about it yet. And there's still science coming out, there's still experimentation being done, and we're still learning about leaky gut. But it definitely is a problem, and especially since we don't quite understand it yet. But we're going to tell you what we know, and we'll tell you what's out there, and hopefully with that information you can be empowered to heal your gut, and that will benefit the rest of your body.
All right,
let's get started with the PowerPoint. So here's the myth for leaky gut. When we talk to our clients and patients about leaky gut, one of the things we'll hear is, but doc, I don't have stomach problems. And so people think that it's just an issue with leaky gut only affects the digestive tract. And the reality is leaky gut can affect your health throughout the body. And you can have symptoms in your joints, or you can have mental emotional symptoms. You can have all sorts of effects that are caused by issues going on in the gut. And so when we talk about leaky gut, don't think that it just has to do with feeling gas, bloating, or abdominal pain. And that's the truth. These symptoms can be seen throughout the body. And that's one of the reasons why it can be so difficult to notice or address, especially for someone who doesn't have a clinical background. So for a lot of our clients and patients, they are surprised to know that their gut could be the cause of these issues. And so part of it is about educating that, yes, just because the problem is originating in the digestive tract, that the problems could be in the joints and elsewhere. So what are some of the effects of leaky gut? Yes, it can affect the GI tract. You can get gas and bloating, cramping, constipation and diarrhea, or any sort of symptom of food sensitivity. Systemically, though, it can cause allergies and asthma, skin rashes, headaches and migraines, brain fog and poor memory, joint pains, difficulty losing weight, and also a host of autoimmune disorders. So rheumatoid arthritis, Hashimoto's, multiple sclerosis, even these can involve leaky gut. And we'll talk about how that happens. A lot of it is because of the immune system and how the immune system and the digestive tract are connected. Metabolic syndrome is another one. We've talked about actually having an entire series on metabolic syndrome. That is a huge issue and one of the reasons why we have such a cardiovascular disease problem in this country. Chronic fatigue and fibromyalgia, PCOS, and hormonal imbalance. Those are just some of the systemic issues related to leaky gut. And we're going to talk about here very shortly about what the mechanism is and how can something that's going on in the digestive tract affect the body. So what is leaky gut? Leaky gut, the medical community is still trying to define it, but it comes down to increased intestinal permeability. And so our intestines, they are supposed to have be very tightly aligned, and they're supposed to have tight junctions in between them that keep particles from passing into the body unless our digestive tract absorbs it. It's kind of like a game of Red Rover. Nobody's supposed to come over unless they're allowed. Now, one of the issues that occurs and what causes the issues with leaky gut is that 80% of our immune system resides in the gut. And so if there's a problem in the digestive tract, then the immune system is going to be there and it can affect the immune system. And so two of the more serious local effects are inflammation and immune activation, and this will spread throughout the body. So let's take a look at a picture of our intestinal lining, some of the things that can damage it, and what that damage can look like. So here we have cells, and this is our intestinal lining. And these cells are absorptive cells, so they absorb the nutrients that we eat and digest. So they absorb them and put them into the bloodstream and into the lymphatic channels so that we can utilize these nutrients.
And that includes vitamins, minerals, and amino acids.
Yes, exactly. All the things that we need to be healthy. In between, you can see these little connections between cells. Those are called tight junctions. And those are the hands holding together, creating that Red Rover barrier so that other things, as we see, food particles, pathogens, toxins, those are not supposed to pass through. And it's that barrier that keeps bad things, essentially, from the outside world from getting inside of us. Now, there are different causes. We can see here we have a break between two of those cells. And there's different causes for that. At the top, you can see it can be stress. Toxins can cause damage. Food particles, if it's a food that you're sensitive to or is causing inflammation, that can cause some damage.
Overexposure to a certain food can irritate the body.
Exactly. Something, if you eat a lot of something, a lot of what we'll hear for someone who's sensitive to something, they'll say, well, I eat it all the time. And sometimes that's part of the problem.
Yeah.
Drugs, especially non-steroidal anti-inflammatories like aspirin, and pathogens. We have this diverse community of probiotics and also pathogenic bacteria in our guts. And if they're not in balance, especially the probiotics, then we can have pathogens that bugs that are pretty mean to our intestinal lining, and they can cause damage too. Now, all these together can lead to leaky gut. And so, for example, I mean, who hasn't taken, a lot of people take NSAIDs or antibiotics. Who doesn't have stress? Stress is a major cause of intestinal dysfunction. And so there's a lot of common things here that can cause leaky gut symptoms. And so a lot of times, and that's what Marian was saying, that a lot of us have it. And it's a serious issue to consider because there are just so many different potential areas that can bring it on. So with leaky gut, you have an opening in the lining. And so particles and toxins and bugs that aren't supposed to get in can get into the body, and they can go into the blood and they can go into the lymphatic vessels.
And when that happens, that's when your body starts, the immune system's turned on. It's not supposed to be there. And then, unfortunately, a lot of foods can mimic our cells on a cellular level. And when that happens, the body starts attacking everything, including its own body. And that's how an autoimmune disease gets triggered.
Yes. So there's a few theories on how the autoimmune conditions get triggered, but foundationally, a lot of it comes from the gut, and it comes from seeing either pathogens or other things that look like us, and our immune system thinks it's our cells, and then they start attacking our cells. And so keeping those things out of the body from leaking in is going to really help protect your immune system. And really, a lot of it comes down to the immune system. As Marian said, there's a lot of inflammation that's created. And studies have shown that inflammation in the gut leads to inflammation throughout the body. And as we'll see, inflammation is a major cause of a lot of diseases. So we have here another representation of some of the causes of leaky gut, because that's what everyone wants to know. What's causing this, and how do I avoid it for the future? So NSAIDs and antibiotics. NSAIDs, so like I said, like aspirin, Motrin, Aleve, ibuprofen. Now what those do is they decrease the body's ability to protect the lining of the intestinal tract. And so what happens is that as food passes through and the food from the stomach is going to be acidified, it can cause damage to the lining. And then obviously that's going to contribute to a leaky gut. What about antibiotics? Well, antibiotics are going to destroy those healthy bacteria that are living in the gut, and that's going to lead to increased inflammation, damage, and also more potential for other bad bugs to move in and again cause damage.
Yeah. So next up we have toxins, pesticides, and radiation. Our world is full of toxins, estrogens, pesticides are in our food, we microwave, and if, you know, as we eat these things and they build up in our body, then eventually, obviously, it's going to cause inflammation. The bugs in our intestines are like the bugs that are in the dirt that they're trying to kill when it comes to growing our food. And unfortunately, when we ingest those, it also attacks our microbiome. And so reducing those is pretty important. And then we have stress. And now in our culture, we are stressed out all the time. We are chronically stressed. And I know when I get really stressed out, and most people are that way, your stomach gets upset. If this happens all the time, just because your life is so stressful, damage is going to happen. And it's a domino effect. And this is just one of those parts of the puzzle.
Yeah, with stress, it's going to affect the actual lining of the gut. We don't get as much of the protective chemicals that help protect our lining from the acidic contents passing through. And we also get less blood flow to the area. And so that's one of the reasons why stress can affect our gut and lead to things like ulcers for some people. For acute infection, basically whether it's acute infection or chronic dysbiosis is just a long-term misgrowth of bacteria. The bacteria that we should have, that healthy guts have, don't have enough of that, and too much of the bacteria that aren't supposed to be there. That would be a chronic dysbiosis. It's just a long-term misgrowth of bacteria. And whether it's that or an acute infection like a food poisoning, just having the wrong bugs in the gut can, again, lead to leaky gut symptoms because there's going to be inflammation and damage. And so it doesn't have to be an acute infection, but if you do get something like food poisoning, then it's likely there was some inflammation and damage, and so steps will need to be taken to heal the area. Inflammatory foods, as we mentioned a slide or two ago, if you're eating something that's causing inflammation, inflammation is the body's its way of healing, but it actually causes, when over long term, it causes some damage. And so you don't want to be eating a food that's causing you inflammation over and over again. And sometimes, especially if it's a delayed sensitivity, you may not know it when you're eating it. It may come on hours and hours later.
Days.
Exactly. So it's hard to tell that maybe the stomach issues, the gut issues you're feeling now may have been something that you had yesterday or the day before, but that can happen. And then lastly, chronic constipation. That's another cause. We rely on a certain speed at which the food is processed by the digestive tract, and if it doesn't pass through quickly enough, then that causes a backup, so you're not getting proper flow of the contents, and it can lead to inflammation, damage, and if there's anything in there that the body is trying to release, one of the ways that we get rid of toxins is through the bile, and that goes out through the intestinal tract. If it's not making it through, then our body's going to reabsorb it, and then those nasty things that we're trying to eliminate end up back in the blood and back in the body.
And we have a question.
Okay, we got a question. Which we're going to address this at the end. If you have any questions, please let us know. And then as we see them, we'll probably just take them at the end unless we feel like we might have missed something. So how can leaky gut lead to so many symptoms and diseases? So this is the issue that we are, it's a major question. How can something that's going on in the gut cause all these issues? So first of all, chronic inflammation. When you have inflammation in the gut, it's going to lead to inflammation throughout the body. Chronic inflammation is one of the major causes of disease and chronic diseases. And so that's why there are NSAIDs and drugs that decrease inflammation, is because it's such a major issue. But if it's happening in the gut because of something that's happening there, because of something we're eating, because of something we're around, or something we're taking, we can address that root cause, and then that way the inflammation doesn't come back, and really address it at the root. But chronic inflammation is one of the major ways that we can have these symptoms throughout the body. Damaged defenses. Our gut, the lining, is supposed to create a protective barrier between what is essentially the outside world. When we eat food, it's coming from the outside, and it's supposed to create a barrier from the outside to the inside. Anything that we eat can have toxins, pesticides, bacteria on it, and it's up to our body and our GI tracts to protect it from getting in. Well, if that lining opens up, then we are really open and vulnerable to what we eat. And lastly, immune system overstimulation. When the immune system is triggered, it creates these pro-inflammatory responses in the body. And again, that is, in acute scenarios, that's really healthy. It's good. We need it. But over time, long term, it's going to lead to pain, fatigue. It can cause damage. And again, depending on where it is, it's going to lead to chronic inflammation and disease eventually.
And a lot of times this will be those people who have a lot of joint pain, or they just feel tired all the time, the headaches, all of that stuff can be related to the condition of your gut.
So what does the mainstream medical community think about leaky gut? So, what have you heard?
I have heard that it's made up, that it's not a real thing, that the junctions are so tight that it just keeps everything out, and it's just something that us healthy alternative people do to make money.
Right, yeah. You'll definitely hear that it's a made-up disease. It's just there to make people feel like they need to take a supplement or do a treatment plan, and that there's nothing to it. Definitely seen a lot of that out there. I was excited to see that WebMD had that on their website, that there was an article from an MD that said it does exist, and it's something that they've seen, and studies have shown that there is something going on. But we really don't know enough about it to really understand it yet. And there's evidence that we're on the right track, and it's not completely made up as some people think. But we're still learning more.
Yeah, and I guess it's so new that a lot of doctors haven't been exposed to the research.
Right.
They're busy and they go to seminars a couple times a year, and there's only so much information you can take in. And also the problem with a lot of the research is sometimes they're studying the role of bacteria in neurological health, that somebody who is in, works on, the bones is not going to read that. Or they're not, or the GI doctor is not going to read what's going on in neurology. They're going to read what's going on in gastroenterology and in their specialty. So there's a lot, there's a ton of studies out there, but there's not a lot of overlap just because there's only so much time in a day to study.
Right. And there's all sorts of studies coming out with medicine in general. Sometimes it takes a while to get to mainstream doctors or any sort of health practitioner. Yeah. And some people are, frankly, just behind the times. And so, but the good news is there is more awareness and more people are knowing about it.
And the studies are happening, and the more they study, the more we learn. I recently read a study where they're finding specific probiotic strains help with certain diseases. And so that's in its infancy. So it's really an exciting time for us because we're going to be able to help people so much more effectively in the coming years.
Yeah, and the good news is as more studies come out, there's more support for it too.
Yes.
Because it can't go the other way. Sometimes when studies come out, it refutes it. But in this case, there's a lot of support coming out. And this actually does relate to our question, so it's a good time to bring it up now. So we have here, there was an article on leaky gut, and that the idea that bacteria coming in via the gaps in the junctions would lead to sepsis or infection. And so it was trying to refute leaky gut because of, wouldn't we just get widespread infections? And so this kind of goes into the element of we're still learning about it. And from what I'm reading, the openings are actually very tiny. And it's hard to, when we illustrate it, when we have pictures, we show these big gaps because it's easier to understand that way. But in reality, the gaps that they're finding are very small. And what it does is it allows certain molecules and chemicals to come in that normally wouldn't. And also remember that you have the immune system up to 80% that's living right there. And so they're there to protect what does pass through. But if they see a lot of things that they don't like, then that will cause inflammation, that will cause an immune activation. And so anyone with allergies or autoimmune conditions, when their immune system acts up, that's not going to be good for their condition because, if anything, they want their immune system to slow down.
And, I believe that the body wants to stay alive. And I follow a lot of doctors who feel the same way, obviously. And, the body is always trying to stay alive. So with 80% of the immune system there, if something does get in, it's going to contain it to a point. Eventually, it's going to get tired, and that's when you start going downhill really fast, and you get sick hard, and recovery takes a really long time, and usually that's when you see us because your doctor hasn't helped you with all the pain, the gas, the heartburn, the migraines. Like you go to all these different doctors and you're on all these different meds and you're not getting better. And as your immune system is getting more and more tired, your body's crying out more and more. I think that they forget how the body works as a whole and how much it wants to stay alive.
Right. Yeah, so we don't see a lot of that, the sepsis and the infections from leaky gut, but it doesn't mean that it's not causing issues. Good question. Thank you. Okay, we're going to go back to the presentation now. Thank you.
All right, it's my turn. So the 4 R's for a really healthy gut. You need to remove the foods and chemicals that are causing inflammation. These are usually done through, I usually recommend getting a food allergy panel than a food sensitivity, which is different than a food allergy. Food allergy panels are what your body's going to react to in that moment, but a food sensitivity panel is more of a long-term, what is happening and what foods are causing damage on a long-term basis, and reducing chemicals, especially pesticides, herbicides, parabens, phthalates, all those things that really inflame the body. You need to reduce the stress, you need to reduce other obstacles to healing, and you need to explore what those are with someone who knows what they're doing. You need to repair the gut lining, and we will kind of go into what that looks like here in a minute. And then you need to repopulate with healthy gut flora, which are probiotics. The foods that harm. Sugar is really popular. Some people say that, we're stressing overkill, that it really doesn't do that much damage, but it really does. It feeds the yeast, feeds the candida. If it's food for the bad bacteria, the unfriendly stuff, it weakens it suppresses the immune system. So if it's already getting food and stuff in there and you're suppressing it with sugar, then you're leaving yourself open to more harm. Chronic consumption of alcohol. eating way too much gluten. It is an irritating food, and usually people have it morning, noon, and night, and snacks in between. And it's a case of overexposure. And if your body's already inflamed and it's already irritated, then gluten's just going to exacerbate that. So removing that for a time can help you heal. Food maps, which are foods that are...
There are specific chemicals in foods that are linked to inflammation and GI irritation. And so some people, if they go on a low FODMAP diet, they can see a removal of symptoms and they can get better. They tend to cause irritation in the gut.
Yeah. Food sensitivities, again, those are, not everything agrees with everyone, and some foods just don't agree with us. I find that most people have at least a couple that are irritating and make you feel bloated or gassy or heartburn or joint pain, and when you can figure out what those are and remove them, then your body can heal because it's not constantly trying to protect itself.
Yeah, and sometimes you don't notice it consciously. When I got my test done, I had antibodies to lettuce and watermelon, which are two that I would have never guessed were causing issues. But I took those out with all the other ones that were there and did some gut healing protocols and got a lot better. And it's the good thing is that getting the blood tests, looking at the antibodies that are in your blood, it just pretty much shows what your immune system is reacting to. It's right there.
Right. It's a great window into what's going on. My food sensitivities are corn, soy, and dairy. And corn was one of my favorite foods. I love popcorn, corn on the cob, all of that stuff. And I had no idea it was linked to my chronic debilitating migraines, or dairy was linked to my GI issues and psoriasis, and soy was linked to my estrogen dominance, and the symptoms that go from that. So, food's powerful. And, what people respond to and what they like and don't like is different on an individual basis.
Yeah.
And then last but not least, again, the toxins, the pesticides, and the food additives. Oh gosh, that could be a whole,
Yeah.
a whole workshop in itself. But the chemicals are added. They're not good. You start researching, it's a rabbit hole. But the best thing you can do is, stick to as much of the whole food as possible.
Yeah, because not all additives are bad, but there's so many out there that it's really tough to keep track of them and which is good, which isn't. So if you're getting whole foods, then without additives in it, then you can rest assured, you don't have to worry about what else is in there.
Right. Exactly. And then, of course, if you're going to want to start the process of healing your gut, there's certain foods that really help soothe it and speed up healing. Probably the top one is bone broth. That is just full of so many good things, collagen, amino acids, all in it. Just coats the intestines and just helps them heal. Licorice, fennel, and other digestive herbs, again, they help the mucosal lining, they help protect you and help speed up healing. Apple cider vinegar is just a wonderful food for so many health uses, and this is another one to add to the list.
Mm-hmm.
And then you have fermented foods, which are probiotic-rich foods that you make at home and save you a ton of money. Versus taking probiotic capsules, you get more bang for your buck, you get more variety. And I think that's really important.
Yeah, you're eating your medicine. And we really don't eat enough fermented foods in our culture.
No, we do not.
Other cultures have a lot more fermented food, some of them, and it's really not there for us, unless we're talking about beer. Other than that,
beer and wine, yeah.
Yeah, or sauerkraut if you go to a ball game. But
that's usually vinegar-based and not even fermented these days.
Yeah, not even helpful.
Yeah, fermented foods include properly made sauerkraut. You can ferment things like salsa and ketchup. You can lacto-ferment pickles. A lot of people get kind of scared. Oh, bugs are bad, but you know what? We're more bugs than we ourselves,
yeah.
And we need bacteria. We just need the right kind. And fermented foods give us that, and they give it to us in the trillions versus the billions with a very little amount. And then coconut products, coconut oil is pretty popular these days, and it is for a reason. It's phenomenal. It's very healing. It's great for the liver. It's great for the body. It protects, it soothes internally and externally on the body. And then there's other digestive herbs. We put it on there twice because they're so important.
They're very good, yes.
Yes, some of them can make stomach acid more acidic. They can soothe heartburn. There's a variety out there, and they're really beneficial. And then sprouted seeds. Depending on how bad your leaky gut is, a high fiber diet's probably not the way to go. Again, it's the FODMAPs thing. They irritate. And so you can sprout them, which makes them almost basically pre-digested. It makes it easier to absorb the nutrients. But depending on how bad it is, you might need to hold off on those until you're into your protocol a little bit.
Yeah, and that brings up a really important aspect of this, that there's no one size fits all, and there is no one thing is healthy for everyone. And so fiber, most people need more fiber and would benefit from it. But this is a case where fiber, too much of it, may actually cause issues. Yeah. And so working with a professional is really a good idea. That way you can get that guidance and kind of learn the verities of, well, when should I do this or when should I not? And is this right for me? And working with a professional and also being aware of your own body and your own response will help you understand that.
And that's what, we teach you, is how to understand what your body's been trying to communicate with you. And that way you can start understanding it. And then another food that soothes, which might shock a lot of people, but it's raw cultured dairy. Like, how do you say it? Kefir?
Kefir.
I call it kefir. It's yogurt, things like that, but in the raw form. So the raw milk is going to be so much better. It has the enzymes that help us digest it. It's full of beneficial bacteria, all these things that we think are so bad for us. But if it's done right, it's actually very good for us. And then also wild-caught fish, grass-fed, pastured animals and their products. Again, the bones, the tendons, the organ meat, everything can be very beneficial for us if it's from a healthy animal raised on the way it's naturally supposed to be.
Yeah, and especially when you're considering the omega-3s and the omega-3 to omega-6 ratio, you want to have a healthy animal so you can get those healthy fats. Because when you get the right ratio, that's going to provide not only nutrition, but it's also going to help with inflammation.
Exactly. A lot of people want to take fish oil.
Mm-hmm.
Unfortunately, a lot of it is rancid. Once it's on the shelves, you have to be very careful about what brand you get. And obviously getting, this is food as medicine. So if you can get it from whole food, that's what we want.
Absolutely.
And last but not least is aloe vera juice. This is one we add with caution. You cannot take it on a long-term basis. But for short term, it is very beneficial. Just like it soothes a sunburn, it also can soothe the inflammation in the body. But taken long term, it can cause other issues. So it's medicine. It is not a food. But again, it's a food as medicine.
Mm-hmm.
All right.
So there are other treatments and considerations when we're talking about gut healing, and especially with the gut. If you think about it, our digestive tracts work all the time. And we're fasting when we're sleeping. And maybe some people, they fast in the morning, they don't eat breakfast. But other than that, we're eating and digesting more or less throughout the day. And so it's really tough to heal the gut. And sometimes we need extra herbs, extra treatments, other nutrients that are going to speed up the healing process and allow the gut to tighten up and form those tight junctions when we are eliminating these sources. And so a common thing for me to do in my practice is do a food allergy panel, take out the foods, and then add in some other treatments that are going to speed up the healing process. That way we can slowly reintroduce the foods and see if there are any symptoms that repeat. And if so, we take it back out. If not, then they can eat that food again. So herbal formulas, there are specific herbs that are very healthy for the gut. They'll decrease inflammation, also increase the rebuilding process. An elimination diet and food allergy tests, both of these they can go hand in hand. Some people do a basic elimination diet where they take out the most common sensitivities. But what could happen is that you won't find an elimination diet that has you eliminate lettuce and watermelon.
Yeah.
So in my case, I wouldn't have benefited from that. And I had tried it before, and it didn't really give me much benefit because it missed on that.
I have had clients who did not want to do the food allergy panel, so we did the standard elimination protocol, and they got sicker. because they were eating all the foods that they were
Mm-hmm.
allergic to. The gamut for this poor client of mine. Turkey, nuts, so she was doing paleo, so she was doing like the nut flours and the eggs, and she's like highly allergic to eggs, highly allergic to turkey, so again, it can backfire, and spending a little extra money to get the actual test done can be so beneficial because, it could just, basically it could tell us, hey, the gut's inflamed and we need to soothe it, and then we test again in 6 months and you don't register on any. Your body was just inflamed. And then, there's times when you really have to eliminate 1 food or 2 foods, like I have to, or, Dr. Clough has to. So it's really good to invest a little bit if this is a concern of yours, just so that we can see a window into what's going on and then help you heal.
Yeah, and it helps you get the individualized treatment. There really is no one size fits all. If there was, it would make our jobs a lot easier.
Yeah, it would.
But it's not a reality. So the more we can learn about you, and the more you can learn about you, the better off you'll be. IV nutritional therapy can be good. If you have really bad leaky gut and you have issues with absorption, getting IV nutrients will help your body function the way it has to. And sometimes that's a good interim therapy as your gut heals, because ideally, your gut's going to be doing enough absorption, you're eating the right foods, where you're getting the nutrients that you need from eating it. And so the IV nutritional therapy is only there to bridge the gap as your gut is healing, and it's on an as-needed basis.
Yeah, there's definitely people who would benefit from that. For one, it's going to help you feel better faster.
Mm-hmm.
So it's going to be easier to deal with the thought of having to eliminate certain foods, especially probably your favorites. That's usually what your standard, what you eat every day is going to have to be eliminated. And so you don't know what to eat. And if you don't have the energy to even think about getting in the kitchen or going to the grocery store and buying all new food, it can really help bridge the gap in that. Absolutely.
Constitutional hydrotherapy. This is one a lot of people haven't heard about. Basically, I'll give you the very short explanation. It encourages blood to go into the organs and then to rush away from the organs, and that the contrast of blood flow in and out towards the core allows circulation is very important for all the cells, all the organs, and getting that change in circulation in and out can do a lot to stimulate their function and to promote healing. Glutamine, MSM, probiotics, digestive enzymes, quercetin, these can all either promote healthy digestion or help the digestive lining. Mm-hmm. Omega-3s, very powerful anti-inflammatory, healthy nutrients. A lot of times people don't get enough of it in the diet. Mm-hmm. And so in supplemental form, it can give that extra boost in that therapeutic dose.
Again, we want to make sure it's from a healthy source. Costco
Mm-hmm.
is not a good source for fish oil, unfortunately. And so working with a practitioner, you're going to get the third-party verified, pure, healthy sources.
Yeah, unfortunately, the Kirkland brand, and not just to pick on them, it happens in a lot of the brands that are over the counter. They don't have the dosage there, and since most people don't know what a therapeutic dose is, those companies can get away with it because they can just give you some amount, and the average person will just look at the price and be happy that it's lower, but they don't know that they're getting something that's really not going to help them because it's too little. It's like if you took, you cut a baby aspirin into 10 pieces and took a little bit. It's not going to do anything for you. You need to have the right dosage.
Love that analogy.
And speaking of NSAIDs, avoid them as much as possible. They are not harmless. They're not completely innocuous substances. There are, if your doctor has put you on a baby aspirin a day for heart disease, then you'll have to have a conversation with your physician first, and that's something we're going to talk about here shortly too. But if you're taking it for pain, if it's not being prescribed, avoid the NSAIDs as much as possible, because one of the more serious things that they can do is the digestive issues, and they just affect the lining. And when you consider the role of the gut and overall health, it's really something that you want to avoid wherever possible. And there are a lot of treatments. If you're taking for pain, there's a lot of things you can do for pain.
Yeah, that won't destroy your body
Yes,
in the process.
Absolutely. So we have a few handouts for you, and this will be sent out to all the attendees as a thank you. And so we're going to go over them now. And this addresses, we also got a question about some extra resources. And so we're going to give you 2 resources here. One is going to give you 5 of the best foods that are going to help soothe your gut, and then we're also going to give you a recipe that you can so you can make some of this at home. Now we talked about all of these: the bone broth, the aloe vera juice, coconut oil, fennel seed, and apple cider vinegar. Really good for the gut, and so
And they're really easy to include in your diet.
yes, so easy.
You know, bone broth is easy to make. You can drink it like tea. You can use it to cook with and make a soup. You know, chicken soup when you're sick. It used to be made with stock, and that's why it was so beneficial. Aloe vera juice, you know, that's probably one of the weirder ones, I guess. But again, it's a temporary food as medicine, not a permanent. Coconut oil, you can use it in everything. You can cook with it. Bulletproof coffee, put it in your coffee, put it in your tea. Yes, smoothies. It's really easy. You know, you can use the full fat coconut milk, the coconut oil, all of it. All forms of coconut are very beneficial. Fennel seed, again, you can add it to different foods. It's one of those things that you can just learn what it tastes good with. I mean, it's in sausage, you know, but there's other ways to use it. You can actually cook with fennel, not the seeds, but the actual fennel. And that has, you know, good properties as well. And then apple cider vinegar, cure-all.
Yeah, so many different uses for that. And for all of these, again, you want to listen to your body. Try them out and see how you respond to it. If you respond well, keep taking it. If not, try something else. Always want to listen to your body.
And these are the recipes. We have one for, you know, a basic bone broth. You know, we have a crock pot version, which is my preferred because I use my stove all the time because I cook. And I don't like to forget about things, which I have a tendency to do, so crock pot's a little bit easier. And then a simple apple cider vinegar tonic. It's really easy to take. Recommend taking it before your first meal. It ups the acidity in your stomach, which means you can break down food. It kills pathogens, and it makes the nutrients so much more available.
What I really like about the bone broth is it's so easy to make.
Yeah.
The prep time is barely nothing, and the crock pot does most of the work. You just, as they say, set it and forget it.
Yeah.
And so it's really easy to make, and you can make a lot at one time. And so you have broth that lasts you.
Yeah, at least a week.
Yeah, and if you freeze it, it'll last for longer. Absolutely. So we have a few questions that could be, actually, this would be a good time to address them. And so one of our viewers is a vegetarian and is wondering if a vegetable broth will help if it's made with a lot of onions and garlic.
Why don't you take that one on?
Sure. Well, I think broths are very healthy. They help to liberate the nutrients from the foods. You know, when we eat, let's say, like a raw vegetable, we have to break it down, digest it, and then assimilate it. And especially with all the fiber that's mixed in there, it's a process that is can be difficult, especially for people that may have already digestion issues. And so making a broth of any kind, you're allowing those nutrients to go into the water-soluble ones will be freed, and it's very easy for our bodies to absorb it. And when you throw in onions and garlic, very healing, especially very good for the immune system.
Yes, great for the immune system. It's not going to have the collagen and glycine and other amino acids that speed healing, but it will boost your nutrition if your gut is able to absorb them.
Yeah, and one thing I'll do if especially to get those amino acids, I like Bragg's aminos. I think those are pretty good. You can sprinkle it in there perhaps and get some of those nutrients. But yeah, there are some benefits to having the animal-based bone broths. The bone broths are very healthy.
And a comment on the bones is quality matters. It needs to be from the grass-fed, grass-finished, healthy, happy cows. So you want to get to know the farmer. You want to get to know the butcher. And the bones are cheap, which is great. It's becoming more popular, so they're actually harder to come by around here anyways, which is kind of fun and interesting and challenging. You can buy them online from certain like U.S. wellness meats. You can buy them. You can get the organ meats from them. You know, but quality matters, so you can't get it from just any cow, unfortunately.
Yeah, and like Marian was saying, to get quality, you're definitely not going to be breaking the bank. My rancher sells them for $2 a pound. Yep. And I use a few pounds per batch.
Yeah, 2 to 3 pounds.
Yeah, so it's not much. So definitely worth investing in the quality. Our next question was about mushrooms and blue cheese, and if these contribute to the healthy bacteria, even though they are fungi and mold. So this is another question where it depends on your body. For some people, they don't respond well to mushrooms or blue cheese, and so you want to. And so this it depends on whether your body is responding well to it. Okay, the next question is about aloe vera gel versus aloe vera juice. That can help, and I encourage you, if you're getting away from the food-based treatments, this is all about food as medicine. And so we're going to give you the healthy foods that we know of that are going to help you get on the right track. But they're not always therapeutic. Foods are nice for setting the foundation. They're good for keeping things moving along, but sometimes we need a little extra boost. And so for any of these extra supports, extra herbs, it is good to go to a qualified practitioner that can help you and guide the process. Because as much as we talk about know that nature can be great and food it can be very healing, nature isn't always nice. And we need someone there who's walking with us, who is qualified and can explain what's happening in the body, what will be good at that time and what may not be good.
Definitely.
And so our last question is on having too much fiber causing issues, and what's a good alternative to a fiber supplement powder to help with regularity. So again, this is one where we can't give any specific advice without knowing what's happening, but there are things like one alternative to help with regularity. Well, first of all, a healthy diet.
Yes. Foundation.
Healthy diet's a foundation. Water's a great one.
Lots of water.
And for some people, after I do an intake and I see what's happening, magnesium can help too. So there are many other options. Another good one is acupuncture. Actually, can be great for regularity. Chiropractic, for me, swimming. If I swim and all the rotation,
some people say running does it.
Running.
I have a friend who's a runner, and she plans her path. And so it's finding what works for you. But I would say that if you struggle with constipation, water is number one. Make sure you're getting enough. It's half your body weight in ounces. And here in the summer, especially here in Phoenix, it's in the 110s, 110s.
On a good day, yeah.
Add a little, make sure you add a little bit of salt to it, but stay hydrated, and that will help keep things moving.
Hydration, body movement, those are the first two. Thanks for the questions. Those are great. Okay, we're going to finish up the PowerPoint now. So to summarize, leaky gut. It's all over the news. Everyone's hearing about it. A lot of people are talking about it. The jury is still out as far as what exactly it is and what is the exact mechanism, but it's being studied. And as study after study comes out, we're learning more about that this is an issue. This is affecting people's health. And it is something that warrants more investigation. And so the people that are treating it and addressing it, we see a lot of benefit as well for people that go through these protocols. A lot of them recover from, could be headaches or migraines, it could be rashes, it can be joint pains. We just saw the list earlier. It can be a whole bunch of things.
Yeah. I actually have a client who came to me. She had moved from IBS to IBD. And we addressed, the food sensitivities and put her on the gut healing protocol. And it was a couple weeks, she was feeling so much better. And then it took about 6 months for her to completely heal from the IBD. But for something that had gone on for many, many years, to be able to heal from it and not have to deal with the pain was just so huge for her. So...
That's fantastic.
And it's, when you work with someone who knows what they're doing and you're able to really address the root cause, it just improves your quality of life so much. And it affected everything. She struggled with depression, joint pain, heart, just the gamut. And after 8 months, she was feeling so much better. And with her doctor, she was able to get off of several medications, actually all of them.
Oh, great.
So it was, you know, a wonderful journey for her, and it was just mind-blowing, really, for her. And I was just thrilled that, you know, she stuck with it and got the results that she wanted.
Oh, it's always exciting on both
Yeah.
sides. Leaky gut can lead to a wide range of symptoms. Marian just talked about IBS, IBD. I've seen it with a lot of skin stuff, a lot of mental and emotional stuff. And so just because if you have gut issues, definitely a good thing to pursue. But even if you don't, there may be something maybe leading to the gut. And one great example is for skin issues. A lot of people don't realize that when something's happening on the skin, our digestive tract is almost like our internal skin in the sense that it interfaces with what was on the outside of the body. And so they can manifest, so gut issues can manifest on the skin. And I've seen some really cool and interesting cases, and people have remarkable turnarounds with skin issues from addressing the gut. As always, and this is a philosophy that both of us share in, and a lot of physicians and alternative practitioners share in, that to really get the most beneficial, the most effective, the most profound health effect, you want to remove the obstacles to the cure. And sometimes we just have to get out of the way of healing. Our bodies are programmed to heal and to get better. And so if it's something we're eating, maybe we're eating a food that we think is healthy but is causing us issues, and if that's the case, a food allergy panel can let you know, and then you can remove that offender and stop essentially causing irritation, especially if you didn't know.
All right. Well, thank you so much for attending. It was a lot of fun.
Yes.
We always enjoy teaching and helping empower you and educate you to getting healthy,
Right.
and using food as your medicine.
Absolutely. We always say that everyone has to eat. You might as well be eating food that's getting you better, not sicker. And also remember, of course, work with a qualified professional. You don't have to do this alone. We really believe that you should have people on your team as wellness advocates that can support you as you move along. Because again, health it's a very serious thing, and we only get one body, and you want to get expertise as you go along this path. But the idea is that you will be empowered along the way by knowing what foods you can eat, what activities you can do to keep you healthy and keep you out of the doctor's office. And then you have the doctors and the other practitioners and the nutritionists to help you as you need it.
It's a team effort, and we're here for you to be on your journey. Thank you for letting us be part of it. Yes,
thank you so much for attending. Thank you for the questions. We hope you got a lot out of it, and we hope to see you again for our next webinar. Thank you.
Bye.
Bye-bye.